Welcome to this educational video by the EBMT Nurses Group. It is intended for nurses and healthcare professionals working in the field of stem cell transplant and cellular therapy, and may also be shared with patients and families. The video explains thawing and infusing cryopreserved haematopoietic stem cells and CAR T-cell therapy. Before proceeding, verify the patient's identity. These patients usually receive conditioning therapy for stem cell transplant or CAR T-cell therapy. This typically involves combinations of chemotherapy and/or immunotherapy, and occasionally radiotherapy. There are a number of different goals of conditioning therapy, which include to destroy any remaining cancer cells, to reduce the number of existing cells in the bone marrow, suppress the immune system, and/or make hypothetical space for the new cells to engraft. On the day of the infusion, cryopreserved stem cells or CAR T-cells are transported in a dry shipper, thawed, and infused into the patient via a central venous access device, CVAD, for safe administration. Before the procedure, the nurse must check the patient's status and vital signs, confirm the infusion details with the protocol and stem cell lab, and ensure all equipment is ready. This includes gloves, giving sets, saline, 0.9% for infusion, syringes, clamps, emergency medication, functioning oxygen, suction, and the emergency crash trolley. A water bath should also be prepared at 37 degrees Celsius. Following local procedures, the patient is administered a pre-medication, and an infusion line of saline, 0.9%, is connected to the patient 30 to 60 minutes before the infusion begins. The patient's vital signs are recorded before and during the infusion. For CAR T therapy, a handwriting test is done with the first pre-infusion observations. A set primed with normal saline, 0.9%, is connected to the CVAD or large bore peripheral cannula, and a slow infusion of the saline commenced until the first bag of stem cells or the bag of CAR T cells is thawed and ready. The cells are transported from the stem cell lab to the clinical area in a temperature-controlled shipper and are thawed one bag at a time in the water bath immediately before infusion. For a CAR T infusion, the cells are usually in a single bag or syringe, and for a stem cell infusion, there are often multiple bags. The bag is gently massaged after thawing to ensure that the cells don't clump or stick. The thawed bag is connected to the IV infusion line and quickly infused into the patient over 5 to 15 minutes, following local procedures. A saline washback into the empty cell bag can be used to ensure no cells are wasted. When multiple bags are given, each is thawed only after the previous infusion bag is complete. The process continues with close monitoring until all bags are infused and the line is flushed. Vital signs are recorded afterward. If fresh cells are used, the same steps apply except for thawing, following local protocols with or without pre-medication. Infusion may take longer depending on the volume to be infused. After the final bag, the patient is safely disconnected. Many thanks for watching this video. Please contact us at EBMT if you have any questions.